Hello, this is our final team presentation, and we chose to do our topic on inner city health disparities for adolescents. My name is Brittany Jackson, and my partner in this presentation is Felicita Brown. This is for our HCA 415 course, and our instructor is Marie Philibert, and today's date is September 14th, 2015. Some facts about poverty and health disparities in the inner city are that poverty and poor health go hand in hand, and poverty leads to poor health, poor diet, and can cause obesity due to malnutrition in some cases, as well as poor dental health, an increased incidence of mental health disorders, and an increased risk of sexually transmitted diseases. Poor health happens to be a huge problem in larger cities. For example, according to the Asian Pacific Post in 2014, Vancouver, for example, experienced up to 50% of children suffering from tooth decay. This tells us that health inequalities in large cities are common and are most concerning for children. Some factors that can lead to these health issues include lack of health insurance, a decreased access of preventive care, poor self-esteem and motivation, low access to fresh fruits and vegetables, a lack of proper sexual education, and alcohol and drug abuse. According to the U.S. Census Bureau, many large cities have up to a third of their residents living below the poverty line. The U.S. Census Bureau also states that the average household in Detroit, for example, makes about $26,000 per year. This is a poor number, and these are the causes of poor health in a community such as this. With numbers such as these, it's no wonder that some people don't make healthcare more of a priority in their lives. Many individuals experience difficulty in obtaining health insurance. This is due to low-income households, which generally have more difficulty getting health insurance due to not being eligible for Medicaid for various reasons. Also, clinics and hospitals in these urban areas tend to experience overcrowding, which then increases wait times and reduces the likelihood that people in need of care will be treated when they need it. Preventive care for inner city youth oftentimes is non-existent. A lack of preventative care causes many health problems down the road. For example, teen pregnancy rates continue to climb, and prenatal care happens to be one of the most important forms of preventive care, and sometimes it doesn't happen for many reasons. One of the main reasons is due to costs, and another possible reason is due to pregnant teenagers feeling ashamed and trying to hide their pregnancy. Having the proper screening early on in pregnancy can prevent many fetal health problems and ensure the mother is doing everything she needs to do to have a safe and healthy pregnancy. The court ruled that the HCA's provisions and intentions of transforming their Medicaid programs from a program that's designed for the neediest among us to an element of comprehensive national plan to provide universal health insurance coverage exceeded Congress's power under the spending clause, according to Sandefur 2015. This is a program that is putting the cost of newly eligible enrollers on the taxpayers. We are all aware that federal funding is the first thing to receive cuts, and as this happens, the cost will become more expensive for that state's taxpayers, which increases the amount paid out of pocket. Another factor that contributes to the health disparities of adolescents living in the inner city is the fact that many of these adolescents are being raised by single parents. According to Stephen 2005, a survey of 453 single parents revealed that only 51% of these parents had adequate insurance coverage. Health insurance stability is significantly higher for those who receive higher levels of welfare, or those who have more work hours, fewer job changes, and a higher education level, as well as those who live outside of central cities. Many of these single parents are women that also have the responsibility of caring for their children without this health coverage stability. According to the U.S. Census Bureau, there are many types of insurances that now make up our healthcare market. We have many people that are living below the poverty line and have government health insurance, including Medicaid, Medicare, TRICARE, and care provided by the military and the Department of Veterans Affairs. However, the high number of uninsured individuals remains a problem in this country. Self-esteem and motivation also plays a huge role in the health of adolescents. Depression is a silent killer and is a disease that can also be misdiagnosed and unnoticed in youth. Adolescents describe depression as a part of life and do not generally associate depression with suicide as a potential solution. However, suicide remains the 10th leading cause of death among Americans, although the rates for adolescents are consistently lower than suicide rates of middle-aged individuals in general, according to Merriam 2013. Proper nutrition is key in maintaining good health over a lifetime. Supermarkets are common in suburban areas, but not urban areas. Large chain markets like Walmart, for example, are very common in smaller towns, whereas inner cities are filled with convenience stores and restaurants, which do not provide fresh fruits and vegetables. People in urban areas may experience malnutrition due to lack of fresh produce, which can cause health problems such as low vitamin C, low iron, poor digestion, low calcium, a decreased ability for the body to produce blood clotting, and a decreased nerve and cardiovascular health. Convenience meals are most common in inner city and can lead to health problems. Fast food chains are known for their dollar menu items and are easily accessible within large cities. Cheap and convenient meals provide high calorie, fat, and sodium content, but seriously lack real nutritional value. And when consumed regularly, these can cause obesity, diabetes, and other health problems. In conclusion, we would like to reiterate that proper nutrition, self-esteem, and preventative care are very important for people living within the inner city. Healthcare in these areas is a privilege and not a right, and it is something that is important to have for long-term good health. There are many people that cannot afford the luxury of healthcare coverage, and therefore they lack in the preventative care and getting immunizations for their children, for extra examples. Lastly, here is a list of our scholarly references used to complete this presentation, and more references here. Thank you so much for watching. Hope you enjoyed.